Before I hurt my hip, my hobbies were taking care of my horses, gardening, generally busy, very busy. So once I hurt my hip, then it was kind of a downhill slide with the pain. But before that, I was very, very active. So slowing down wasn't an option. I went to pull the pump out of my koi pond, and I was leaning over the pond to pull the pump, and the pump slipped out of my hands and went back down into the pond, and unfortunately took me with it. When I got back up out of the pond, I was aware that I had some pain in the hip and down that leg, but I thought I'd probably just, the angle I'd fallen had just probably pulled a muscle or something in the leg. So I thought I'll be okay in a day or two and it'll wear off. Unfortunately for me, it continued to deteriorate, and that happened in March, and it took me until September to finally go see about it, when I was really having problem moving. If I sat down in a chair and went to get up out of the chair, I had a terrible lot of difficulty with pain, and then walking was unbearable. If I went to try to kneel down to do anything, that was absolutely intolerable pain. But I just kind of, for a while, just thought, well, it was age-related, so I would get over the problem, until I eventually went to see Dr. Morrison and did the x-rays and the MRI, and it showed out that the hip needed replacing, which was a bit of a shocker. Dr. Morrison, during the whole time I went to see him, it was like going to visit a friend. He sat, he listened, he had empathy for me at the time, because I said I had horses. I wanted to be able to go back to working with the horses. Once I had the surgery, I was amazed at the recovery rate, and the same day was able to get up out of bed and walk without any pain at all in the hip. The recovery time total was about 6 months to when I was back working with my horses and doing life that I'd enjoyed doing prior to having the injury and the surgery, and it was such a relief to not have that pain anymore. It's amazing that you can injure a hip and be unable to really walk or do any activities because of the intense pain, but then once you have the surgery, you can resume life and be pain-free and go back to being, in some instances, better than you were before. I would highly recommend anybody who has pain or discomfort in their hips to go and see Dr. Morrison and to be relieved of that pain, so that you can resume your normal activities and go back to your quality of life. So I can't speak highly enough of the treatment that I received from CMH.